Hi, this is Dr. Jovita. We all know that oral cancers are caused by tobaccos in various forms like Hans, Zara, Zutka, and betel nuts chewing. Added to that, alcohol has a synergistic effect to produce oral cancers. 95% of the times, these are the reasons: tobacco usage and alcohol. But 5% there is a cause because of sharp teeth or broken teeth, decayed or septic teeth, and also ill-fitting dentures or overhanging restorations, and also implant. These can be a risk factor for cancers in the oral cavity, especially in the lateral side of the tongue, in the alveolus, gingiva, and in the inner surface of the cheek, which is the buccal mucosa. So there are actually in research database ever since 1946 up until almost 1918, we have around 788 articles, out of which 22 articles are just mentioning sharp teeth as a reason for cancers. And when cancer develops because of sharp teeth, the very earlier on in the stage, lymph nodes can be affected, and the disease is actually resistant to chemoradiation, and the results are, and the outcome is pretty much poor. How exactly this sharp teeth causes cancer? It actually causes a constant irritation of the mucosa, and that irritation will lead to inflammation. That inflammation produces a lot of free radicals, the oxygen radicals. This oxygen radicals will lead to angiogenesis, that is, blood vessels, newly aberrant blood vessels are formed. DNA repair mechanism gets impaired in that stage, and when there is an impaired DNA repair mechanism, it leads to cancer by producing a lot of transcription factors. Now, that is why it is important that we pay attention to these constant irritation. Dental vigilance is very important. The odds risk by causing chronic irritation through sharp teeth is around 9.2%, but the odds risk because of dental processes alone is about 2.28. The odds risk because of chronic trauma is 9.2, and the odds risk because of these processes or ill-fitting dentures is 2.28. So when there is an ill-fitting denture, it can cause candidiasis and epithelial colonization, which leads to leukoplakia, and slowly leukoplakia or erythroplakia can lead to carcinogenesis, cancers. That is why dental vigilance is extremely important in preventive oncology. One needs to know that sharp teeth can cause cancer, and therefore if anybody has sharp teeth, better to address it and help the patients to go to a proper dentist and sort this issue out so that we can prevent cancer.